This is Christian Marold from HealthManagement.org. Welcome to another DigiTalk. Our guest today is Dr. Janina Beilner from Siemens Healthineers. She is Senior Vice President Education Services. And today we will focus on effective workforce transformation. Janina, Siemens Healthineers can be considered as one of the industry leaders within their own staff development. Would you be able to explain what are the key challenges impacting today's healthcare professionals?
Hello, Christian. It's a pleasure to be here. And yes, we do see tremendous changes in the healthcare environment, and especially if it comes to staff and skilled staff. So the staff shortage in healthcare is a topic that is now widely known also in the public. And let's start a little bit with some statistics. So why is it so important that we are looking into the topic? We all do know that there is an aging population. The World Health Foundation just published some numbers that there is more than 500 million people older than 65 in 2030, which need healthcare. Plus, on top of that, we do see the baby boomers now also getting into an age where they would need more healthcare. On the other hand side, we do see a decline in healthcare professionals who could provide these services. Statistics say that there is 15 million shortage of healthcare professionals in 2030. So this is a challenge. Together with our customers, we are going to address it and to co-develop solutions to address this.
Janina, how important are education and continuous training for healthcare professionals?
We do see a tremendously rapid development of new technologies, which as a result mean you need to educate yourself to be able to handle those new technologies which find their way into your daily work, into your clinical routine. Only if you are a lifelong learner and you keep yourself educated, trained and skilled with these new technologies, you could provide the best healthcare for the patients and for your employer and the institution possible.
What are the latest technologies that can be applied to education and learning?
We are looking in a broad variety of new technologies on hand, as there is, for instance, AR and VR technology. Just imagine you could create a safe environment for healthcare professionals to train certain interventions, let's say in the operating room. This really helps to give the confidence and competence to a healthcare professional to treat the patients in the best way possible. Furthermore, there is of course learning platforms. We are using PEP Connect and PEP Connections, where we are using artificial intelligence to tailor-made and to find the individual learning paths to make learning an experience really worthwhile spending your time and getting the most efficient and effective learning out of it.
The way learning is delivered today has changed dramatically. What factors help with the transition from a traditional to a hybrid learning model?
The way of learning has changed and is continuously changing. And that is why we have to adopt the way how we are teaching. So the hybrid learning approach brings together both from the best of both worlds, the classroom training on the one hand side, and also the digital delivered trainings or learning nuggets as we call them. So you could pre-train yourself by watching videos online. The next stage could be that you have a synchronous training class before then you get into a classroom and you get your hands-on training. By that, we are making sure that the training is most efficient and effective, plus it is tailored to us as humans, our human nature, because we are hardwired to learn every day.
Which workforce solution offered by the Siemens Healthineers addresses the challenges of healthcare professionals, and how do you as a company support them?
Well, we all do know that there is really a skilled staff shortage out there in the market, as we have talked about earlier on. So how can we address this shortage without getting in competition with our customers? The answer is co-creation. Co-creation of a vetted pool of healthcare professionals, which we share. So that might be Siemens application specialists, that might be freelancers, that might be employees of a hospital that get the okay to work also in different hospitals. And just imagine you have an Uber-like platform where this pool could be addressed via. So imagine you are the head of a radiology department and you do know that you have some diseases, some illnesses in your staff, but you need to cover. So you could pull, like an Uber driver, you could pull this vetted healthcare professionals from this pool for a day, for an intervention, for a week, for a month, or maybe even longer. So that is what makes it so successful, that we bundle the limited resources that we have, that we use them together to make it more efficient and effective.
Now this seems to be really a very helpful and a very innovative approach, in particular when we consider the staff shortages. Now, how can, in a field like, let's say, imaging or radiology, how can they benefit from virtual training solutions?
Virtual training solutions gives you more time, as the traveling time to a school, to an academy, is not there anymore. So conveying knowledge online is not only a faster way of conveying knowledge, it's also a more sustainable way, as we could show that more than 20,000 tons of CO2 we could already reduce, let alone in this year, by having this hybrid learning approach. And another important thing is, if you do learn online with, for instance, a simulator in the cloud, which is basically a digital twin of an imaging system, you feel way more comfortable once you are entering a hospital and you have it in front of you. Because anytime, anywhere, this digital twin that we are offering as a learning solution, you could use it. It's a smart simulator in the cloud. So you can hit the road running if you want so.
Now this digital twin is definitely something which you hear over and over again, and it seems to become a real hype. But can you explain to me, how can one achieve hands-on training experiences in a remote setting?
So absolutely, Christian. Your work as, let's take a rad tech, has a lot to do with the user interface of an imaging system. And this is, you could call it buttonology. Buttonology is very easy to be taught in a 100% virtual way. Plus, there is also remote scanning solutions. We call it rescan, where remotely our experts help you to scan this patient on the table, which means you can completely focus on your patient in the hospital and you put remote support by an expert. Plus, this expert, and it's addressing now the staff shortage again, could not only have one scan, but It is possible to have now 2 or 3 scans supported by a professional simultaneously.
You mentioned one of the critical pain points. Healthcare professionals are under huge pressure in time and in overloaded work. And I'm wondering, how can they cope with additional training and learning as they are anyhow completely overloaded with their work?
Great question. And that is something that has to do with the culture of learning and the attitude of how you are approaching learning. So also within Healthineers, we do have a culture of learning. That means that the managers, top management, is giving you time to learn. And it might be very flexible. It might be 5 minutes a day, an hour a week, a day a week, that it seamlessly integrates into your workflow. And this is so important. It's that you repeat and that you test yourself on a continuous basis. To have on block 8 hours of training is very hard for us as humans to digest. If you have learning nuggets, 5 to 10 minutes every day, that is possible to seamlessly include into your daily routine. That is where real learning is happening. And this can only be done in a virtual or in a digital way.
Now, assuming that you would run a healthcare organization, how would you address the problem of a staff shortage?
Well, first of all, thank you that you trust me running a healthcare organization. I do think that this challenge is really, really manifold. Of course, you do have HR as a partner in crime, and then you are creating really a culture of learning. You will have to implement a learning experience platform where your employees, but probably also if you talk about democratization of learning content, the public could access. It's a learning ecosystem that you need to create where you could pull yourself proactively as a learner, the learning that you need. On the other hand side, you could also use the guided learning paths where you put suggestions from an AI in the background that says, "Hi Janina, you haven't been here for 3 days. Last time you learned X, Y, Z. May I suggest that today you learn this and this and this? It might be interesting for you." So looking into the industry, if you buy something online, you do see it. We all do know it from our daily lives. And that is also something that you could implement for learning, for education, to really have a lifelong learning experience.
Now you with the Healthineers, you have won a lot of awards wherever you see when it comes to your own workforce. But what solutions, or do you offer solutions to healthcare providers? And if yes, what kind of solutions would this be in order to help them with their workforce struggle?
So, of course, we do that. We are using as a learning experience platform PEP Connect and PEP Connections, and we do share that with our customers and with the public. On PEP Connect, there is already a lot of learning content accessible for free. Yet, we also do offer PEP Connections, which means that you as a customer or a user, you can create your own space. All the administration is up to you. You could upload your own learning content. You could affiliate your employees or employee groups to certain learning materials. And you could also monitor the progress of your employees, whether or not they have achieved their learning targets. Yet there is this other solution I have already talked a little bit about on CrewPlace. You have this Uber-like platform where we are sharing a vetted healthcare professional pool with our customers. And they could pull, when they need, a vetted professional for a certain amount of time, for an hour, for a day, for a week, or even for months. Mm-hmm. And this is becoming really popular, as we do see that also the trends in the healthcare professional world change. So we now do see, especially in the US, traveling nurses who really embrace this opportunity, not being static at one hospital, but having the liberty to work at one hospital for 1 week or 1 month and then move to the next one. So this is really enriching also an employee's working life.
Now you were mentioning something which was striking me. Namely, you said, I can, as a user of the PRP platform, upload my own content. Is this like an open source healthcare environment where I can share this then with other healthcare professionals, where I can learn from them and they can learn from me? And this, of course, gives me then automatically, or brings me to a complete important angle of understanding. Are there any commercial benefits?
Christian, you pretty much explained the concept of PP connections. Yeah, that exactly was the driving idea behind that. You could create your own peer groups, which you can invite. Let's say a hospital here in Germany, a radiology department, is in any way affiliated or friends with another hospital, let's say in the US. So you could absolutely invite your friends or your colleagues to join your group. You could exchange the learning material that you have created. You are the ones who curate the content, and you are the one who is responsible for the content that you do upload. So you as a user or as an administrator of the group, you are in the driver's seat to decide who is learning what and what do you want to share with whom.
Yeah, I really feel when you see all these working groups and all these actions and activities where these healthcare professionals actually have to travel to conferences and have then their workshops or whatever, I really see a huge demand and definitely a huge opportunity in this. And I'm very grateful that you within the Healthineers are offering such a solution to the healthcare providers. Now, Healthineers, they have won several awards related to their own workforce. So obviously you do here a tremendous great job, because whenever you see any awards, you guys are always on the top. Do you have any magic potion for this? How do you do this?
I'm not sure if it's a magic potion. What I do see, it's really an open spirit, the willingness to learn, and that people stay curious, and that we really do get the freedom to create this space. So for instance, I'm also responsible for the entire internal training for our techs and also for our apps. And there we do have this kind of safe environment where we could really test new things, new technologies, where we get direct feedback from our colleagues, whether or not this training is working. I've been talking about virtual reality, for instance. Yeah? Does that work for a tech where you think haptic feedback, like for a surgeon, would be really important? Now we found that the haptic feedback for a tech or also for a surgeon is not the primary focus if you want to learn something in VR. VR is really great to train the different process steps, to give you the confidence if you set up an MR or if you're in the operating room, that you know what comes next, what to do if.
Now, let's assume we're in fairy tale world. If you would have one wish when it comes to the education and to the development of the workforce in healthcare, what would this one wish entail?
So my wish would be to stay curious, yeah, and to stay curious not only about learning but also about yourself. Yeah, what feels good? What helps you in coping with the tremendous wave of work that we all do see? And then pick the learning elements that could really help you. Because, and this is another important topic, Christian, I would like to mention, especially in healthcare. Yeah, we do see a lot of work, more work and more work, overwhelming work sometimes. We do see burnouts, and we do see that people need to take care of themselves, because only if they take care of themselves, they can take best care also of the patients. So that would be really my wish, that people learn, and that people learn also to best taking care of themselves.
Okay, Janina, you are so right. Burnout, taking care of oneself, this is absolutely of prime importance. Because I hear all the time you meet, oh, I have no time. When it comes to meetings, I have no time. And then they have a heart attack, and at once they have all the time. Or they have diagnosed cancer. So I'm so grateful that you actually really highlight this important angle and this important understanding to be curious and to take time. Now, who is Janina as a private person? Would you mind telling me what is your top management tip?
I would say stay real. Do what you are passionate about and what you are convinced about. People will immediately feel if you mean something or if you do something because you have to do it. It comes to me, for instance, I am convinced of lifelong learning. I'm also a lecturer at the Friedrich Alexander University in Nuremberg-Erlangen, because I really do believe that education, continuous education, is so important, and that also sharing what you have learned, maybe with the younger generation or with peers, is really what could move the world.
Now, you have a tremendously successful career, and you are really in charge of one of the most important business units with definitely a huge future within the Healthineers. What would you, in this context, single out as your personal career highlight?
I think it's not one point. I really do believe it is the journey. So what you have summarized, to become successful and to stay successful, it's not a one-time thing. It's really a journey. So looking into the past, also for me, it was a journey. I found what makes me happy, what I can be passionate about, and what I am convinced about. And that I was then fighting for, and I kept pushing. Yeah? And this is what seriously is extremely satisfactory, and that is what keeps me going and motivated every day.
Now, despite all the beauty, was there any disappointment? Was there a serious setback?
Absolutely. And I trust that from failure, you can learn the most. And my lesson is fail fast, and try again. And believe me, there have been also many things that did not run smooth in my past. Do not give up. And also, important lesson, listen to others, actively listen to others, and ask also for support. If you probably don't have the right answer, other people might have it. As a team, you are stronger, and you will win, and you will always find a good solution to a challenge.
Now, if you wouldn't have chosen this career path, what else would you have liked to become?
Well, I studied medicine, so I think I am pretty close to what I always wanted to be. I want to be in healthcare. I wanted to help people, and I hope this does not sound too much, but I really do believe that everyone could do his or her thing to make this world a better place to live.
Now, besides the private Janina Beilner, do you have any interests outside of work, as it seems that you work a lot?
Well, work is for me really fun, and I'm filling my time, as said, with really learning myself. I'm very much into AI and digitalization in healthcare. Plus, I am looking into new technologies, like, for instance, quantum computing, and what this kind of new technologies could help us in healthcare. What kind of use cases, what kind of applications might there be in the future? So that is something, believe it or not, I really like to look up, to read about in my spare time, if I'm not somewhere outside hiking, biking, skiing, or whatsoever.
A true Alpine lady. I love it, being myself an Austrian. Now, last but not least, and this is always my last question. What is your favorite quote?
My favorite quote is, "Do what is right, not what is easy."
Dr. Janina Beilner, thank you very much for this most interesting talk about effective workforce transformation. You have been at the forefront to really guide and spearhead a drive as well within the Siemens Healthineers with pushing this PAP Connect. And I know many years ago we had already some interviews where you were sharing these great ideas. And as well, a great thanks to the Healthineers, as the Healthineers seem to be at the forefront in offering solutions, is one of the biggest struggles for the healthcare organizations.
Thank you very much, Christian, for the invite. It's a pleasure being your guest, and always fun to talk with you.
This was another Leaders Talk with Christian Marold. Please like this video. Subscribe to the HealthManagement.org YouTube channel, as this is the best way to stay in line with the latest developments in healthcare management, in leadership, and with winning practices. Thank you very much indeed.